I've had lots of questions lately about the COVID-19 vaccine. What does it do? How does it work? In terms that we can all understand. There's lots of videos, lots of websites out there trying to give you lots of information to try to work this out. And I hope that I can explain it in terms that are user-friendly, so that you feel more at ease and more equipped with the information to make your decision about getting the vaccine. First, it's really important for us to understand what our immune system does, how it works. Basically, your immune system will attack anything foreign in your body. It can take time to ramp up that response, and that's why we need vaccines, because the vaccines prep our immune system, get it activated, get it ready to recognize, so that the next time that it comes into contact with that baddie or foreign body in our system, that it can immediately start to ramp up the response. And once you've had a response to that foreign body, your immune system is very clever. It remembers, so it can do it again the next time. So it's really important to keep that in mind when we're thinking about vaccines. When we're talking about the COVID vaccine, we need to understand that you're not being injected with the virus itself. It's actually, you're getting injected with something called a spike protein. So we'll call it Spike. Spike is terrible, he's mean. He is actually the instructions on the outside of that COVID virus that tell it how to get into your healthy cells and invade. So the scientists that came up with this vaccine are really, several vaccines are really, really clever. So they're not injecting you with the virus, they're injecting you basically with the blueprints for making Spike, so that your body can recognize Spike once it's injected, and it actually, you get the blueprints, it recognizes it, it starts to make some of Spike, not the virus itself, it starts to make some Spike, and your body immediately goes into immune response. It says, hang on a minute, what's Spike doing here? Why are we making this? Let's attack. So when you get your vaccine, you're being injected with a version of the instructions for Spike. You're not getting the virus itself. It will not change your DNA. You're getting the instructions. Your body will produce this response. So when you get your vaccine, when you get side effects such as not feeling super well, you might be a little bit achy, might feel some chills, might not feel very well for a couple of days. That's your body saying, hello, what's Spike doing here? Let's attack. That is that first ramping up of a response that you get when you get your vaccine. It doesn't last for very long. It gets, eventually gets flushed out of your system, but your immune system remembers. It's very, very clever. So the next time that your body comes into contact with that COVID virus, it remembers and it will attack. So in that way, your immune system is ready, it's prepped, and it's prepared to be able to protect you. So it really, not to simplify all the amazing work that scientists have done, but it really is as simple as that. Another main issue that people have been raising to me is they're a bit hesitant. Lots of younger women in the health and care industries, social care workers, etc., want to get pregnant in the future. And there's this misinformation going around that you'll be infertile if you get the vaccine. Basically, what happens when you get this vaccine is actually it goes to your lymph nodes, so that's your immune system sort of factory, does its job with that spike protein. Your immune system gets ramped up to attack Spike, and then it gets flushed straight out. There's nothing that would affect your fertility in the future. So it's really, really important, and I think that's one that's making a lot of women quite hesitant, but it will not affect your future fertility. Also, if you are currently pregnant, the recommendation is that if you have any other particular vulnerabilities, if you're a shielded person, for example, that you can have that discussion with your GP, and you are eligible to get the vaccine as well. If you're breastfeeding, you can also get the vaccine. So it is very, very safe. The vaccines have been through extremely rigorous clinical trials, and main point is you're not getting the virus itself. You're getting that nasty little Spike instruction booklet, and your body will know how to attack.